The treatment of migraine headache involves 4 possible approaches. The first is to avoid the triggers or other factors that may lead to a migraine. The second is lifestyle changes, such as a healthy diet, a regular sleep pattern, and biofeedback. The third approach is the use of acute treatment with medication taken at the onset of a migraine. Fourth is preventative therapy, where medication is taken regularly to prevent the onset of a migraine.
You can sometimes do non-pharmacologic therapies for migraine. Simple things like avoiding triggers and leading a healthy life with regular habits often benefit migraine patients. If you're going to need to treat the migraines with more than that, you're talking about the use of either acute treatments for headaches, something you take when you get the headache to try to shut it off, and or if the headaches are frequent enough or troubling enough, some sort of prevention, something you do every day to try to make the headaches fewer, milder, or shorter. Fortunately, we have many good acute therapies for migraine now. We didn't 15 or 20 years ago. The general principle is as soon as you know that it's a migraine, you want to treat early and mild if you can. If you wait till later in the attack, you tend to get more side effects, use more medications, and get a less good result.
Several types of prescription medications are used to treat migraines. A group of drugs called triptans are the most effective. Another drug that is sometimes used to treat migraine headache is dihydroergotamine, also called DHE45 or Migranol. In addition, many of the same non-prescription pain relievers that are used to treat tension-type headache are sometimes effective for migraine headache. The fourth approach for treating migraine involves the regular use of preventative medications.
In choosing preventative therapy, you need to really consider the impact of migraine, or whatever sort of headache you're treating, in fact, on the patient. If the headaches are uncontrollable with acute medications, that would certainly be one reason to consider prevention. If headaches are occurring more than 2 or 3 days out of the week, prevention is probably indicated so you don't have to worry about analgesic rebound. If the patient has been missing work or missing school, despite having access to adequate acute therapies, that's probably another reason to consider preventative therapy. And of course, if they have other conditions that are associated with migraine, it would make a lot of sense to institute a therapy that would treat both conditions.
Examples of preventative medications include amitriptyline, divalproex sodium, propranolol, timolol, and topiramate.